Okay, so I'm going to say a little bit about the process for the breakout session, and then I'm going to say a little bit about the intervention, initiative, program, whatever it is on that spectrum that we just talked about in the breakout is going to be. What we're hoping to do is that in your tabletops, and we had to do a little bit of a reshift this morning, so our distribution might not be quite as intentional as it was originally, but we tried to get a mix of people at each table. So there's some people who are health folks, some people who do community work, some people from the Wellville projects themselves in Spartanburg and other cities, and some people who are evaluators, so kind of a mix of people who can bring different things to this evaluation design process. And what we would like you to do is to use, we have provided for you as a tool, the Rainbow Network questions. And it's way more than you could possibly do in the hour that we are going to have for this. But with the goal of, one thing is just to really have a concrete example where you walk away from this realizing there are a lot of tasks involved in designing an evaluation, and it actually takes a lot of time. So it's okay that you're only able to scratch the surface in an hour. And then it's an opportunity for those of you at your table to share your experiences from approaches to past work and what you would bring to bear on this work. And then, one goal is that by doing this in multiple little small groups, we're just going to kind of generate a pool of ideas about approaches that could be used. And we have note takers at each table who are going to track, they're not going to document the whole conversation, but they're going to try to track a few key takeaways so that we can document those and feed them into the Wellville process and into the kind of broader world change that we're trying to achieve. So, once we let you go, we don't have assigned people who are in charge. If your table wants to appoint or nominate a specific facilitator, you can do that, or you can just kind of collectively as a group go through the questions. But we would suggest that you just take a couple of minutes to just read over those better evaluation questions, each of you for yourselves, and maybe take a look at the Way to Wellville description. And then we'd suggest spending about half the time in the manage, define, and frame bucket of questions. And in your version, we've highlighted some of the ones that we think are particularly applicable when it's a hypothetical situation. Some of them are more specific than is necessarily going to be helpful to talk about because you don't actually have any resources, for example. And then to spend the other half on the describe section, the causes section would sketch a little bit more into the data sources and what methodological approaches you might use, what kind of sampling, those sorts of questions. Our last panel of the day is going to dig into use of evaluation a little bit more. So we kind of left that off the list of priorities for this, but that doesn't mean it's off the table. Really, you as a table can decide what's on the table among those questions, and you can pick a couple and spend a lot of time on them. You can go through a few and just surface a few ideas as you go. But we're hoping they'll give you at least enough of a guiding framework for the things to think about as a group. So we're hoping that for at least a couple of the questions, you really will dive into some specifics. So it's that, that's also why we want to have a concrete example so that you're really saying, oh, a good source of information for this might be, most cities have some amount of population health data that they collect, and that could help us answer this question. Or, it seems like we could do a survey, or it seems like a survey would never work. We should really do some interviews. So that kind of specificity, I think, will help advance the conversation in terms of what tools are available and hopefully part of that will raise is a discourse about what are the advantages and disadvantages of those things. What's feasible, what helps you answer which kinds of questions. And then to also maybe talk amongst yourselves about what challenges you foresee. So, we think we're going to do this and it's going to be great, but what's actually going to what do we think might actually happen in reality? And the people from Spartanburg might have some particular insight about what might happen in reality in Spartanburg or a place like Spartanburg. So one thing to say is that this is really just a brainstorming session. You are not expected to come to consensus as a group about the best way to do this. So if you have conflicting ideas, that is totally fine. We'll write down both options and what was advantageous or disadvantageous. So you don't have to come to a group message at the end. And then also just to keep in mind that there is a diversity of experience at the table. So some people know community engagement really well. Some people know evaluation really well. So just keep that in mind. And if you find yourself using jargon or coded language, as Ivan said earlier, to ask each other. If you don't understand a word someone is using, ask them to explain it, for example. So that's the task overall. And now I'll tell you, any questions, first of all, about those instructions and the process before I give you the hypothetical? All right. What I am about to tell you is a hypothetical program initiative, which I generated going about it entirely the wrong way based on the conversation we had this morning, right? I just wanted to emphasize that. So we had a panel of people who were helping us learn a little bit about what the community valued and need, and then over lunch, I listened, and over lunch, I went away, and I made up a thing that I think would be good for them to do. That is totally not what you would want to do really in the real world, right? That was exactly the what not to do that we talked about. I just wanted to make that very explicit and transparent. Obviously, for reasons of convenience, I couldn't do a whole iterative process with them, but I just wanted to emphasize that. I did do a focus group of one. Regina helped me out, and we did a little back and forth about the idea. So a little bit of iterative engagement. So that's the first disclaimer. But I picked up on a couple of themes that came out of the conversation. One was that there's a lot of fragmentation in Spartanburg. So, Spartanburg is not one community. There's these different neighborhoods, and those neighborhoods they're not diverse. They do not communicate with each other a lot. There's a lot of fragmentation and segregation in that way. Another theme that came out is that people do not know what services are available to them. There's a lot of need, but not a lot of knowledge about what's available. That was the story about the probation officer, as one example. And then another one was that the people who provide the services are not well connected to the community. So people are coming to do, they're either in the health system and don't really understand the community and the context in which their patients are happening, or even they might be community workers, but they don't really understand how best to talk to and engage with that community. Taking those as the problems and the idea that ultimately we want this to be something that will help people have their needs met and eventually improve their health as they understand it. The task, the goal of the project is going to be to develop a cadre of navigators. So this is going to be a worker whose job it is to connect people to the services that are available to them. So these are people that probation officer could call and say, this is a community navigator, and I'm going to give you their card, and they're going to help you get housing. They're going to help you go to the community health clinic. They're going to help you get a primary care physician. They're going to help you have access to government support for food, whatever it is that particular person needs. That navigator is also going to work in the other direction, which is that they are going to help the services match to the people who need them. So it's all about improving access to services through this cadre of workers who are navigators. The aspect in particular, then, of those navigators is that the training program for those navigators is going to include a component where community members train them. So there's going to be a partnership of stakeholders in the community who help develop a training program so that those navigators will actually know how to talk to and work in the community. A couple of key members of that partnership is going to include the faith community, because we heard about how right now that's a very siloed community. So one of the aims is to make that community less siloed as a result of being engaged in this sustained partnership over time. One of the other first questions is going to be who else needs to be involved in it, but it's definitely going to involve the faith community. Obviously, it's also going to need to involve all the people who provide the services and who might train the navigators about those services. So when you think about who needs to be involved. We don't want to spend too much time developing the actual initiative, so you can just decide on some hypotheticals and move from there. I didn't have time to come up with an entire theory of change over lunch, but a couple of the aims that are matched to aims that Wellville has been thinking about. One is that part of this plan is to develop a sustained partnership among a subset of stakeholders in the community, faith-based plus others. So the trust, and we really heard that one of the goals is first the relationships, and that even if in 5 years it's just that there's a sustained dialogue, that would be a valuable outcome. But then when you think about the broader community outcomes, it might be that there's improved access to housing, that there's improved health because there's improved access to healthcare. You might get better academic achievement because youth in the community are being linked up to the services they need to be able to succeed in school, et cetera. So hopefully there's some stepwise paths to that. That's all the specificity I'll give, right? So you're building a cadre of navigators, and part of building that cadre of navigators is that they are going to have a training program in which community members themselves are the trainers, and they are training those navigators to be capable of truly engaging community members where they are. Yeah, sure.
I can't hear you.
Sorry. The navigators are only going to navigate them to the resources that are there. Do we also think about the resources that should be evaluated?
That would give you a much more complicated systems change initiative to evaluate. So if you would like that to make your frame that, then you can. If you would like to set slightly narrower boundaries for yourselves, you can do that too. Yeah.
So the navigators are from outside of the community then?
Not
or
necessarily.
They can be from within as well?
Yeah. Okay. I mean, one of the things we really heard is that, how in the community do you really need to be in order to know the community? So you might live in one part of the community and be from the community, but not actually know that much how to do it. So given that one of the goals was to build things across neighborhoods, the idea is not just that you would pick one neighborhood. So the Voyagers was a great example where they really focused in on kind of a relatively small geographic area. But part of what you're trying to do here is to have these navigators be citywide. So it might be, there is no community that doesn't need people to help them get access to services.
And one more, are we imagining this evaluation plan for Spartanburg or for an imagined community that is somewhere else?
Yeah, your frame is definitely Spartanburg, but you don't need to get so specific that you need to know for sure that it matches Spartanburg's content. I mean, we definitely wouldn't have time for that, but we're going to think about this happening in Spartanburg. So if you want to think about context, you can make your Spartanburg representative be the person who weighs in on the context in which it's happening. Anything else? I will be available to answer questions in which I probably don't already know the answer, but if you need a specific answer about the initiative, I will make one up.
How long do we have?
We're going to have about an hour.
Okay.
Yeah.
I'm a little confused. Are we supposed to start from square one with our group about Spartanburg, or to build on your navigator model?
The thing that you are designing evaluation for is this navigator initiative.
Okay.
So we did the step of engaging the community and finding out their needs in a very surface way, but we're saying this. You did that part about you've engaged the community, but the idea is to build a sustained partnership across these faith communities. So you might still need to plan in some developmental or formative part of your evaluation. Yeah, this is definitely a little bit of an experiment, so it's not like we imagine this is going to go super perfectly, but it seems like it's an opportunity to do something in a slightly more concrete way, and we'll see how it goes. Yeah. There is no right answer.